have a question on the reopening of health services. It was expected that the health services roadmap would be published. Has this happened, and do we have a full service yet for outpatients, inpatients, acute, elective, emergency care and community health? And if not, when will full services return?
Thanks, Deputy, and thanks for your opening comments, which are appreciated again, and other deputies too. Just on the reopening, we republished our plan a few weeks ago now, back in July, the end of July, which was for the reopening of all of the services, and it's a document that's on our site which steps through the various services, the timeframes for opening throughout now, and each service by service by service, the various timescales throughout now, through winter and onwards. So I'm happy to share that again with the committee if it's useful, but that's up on our site. That's been published.
Yeah, I appreciate that. And a colour-coded alert system is meant to replace the phased reopening of the economy. How would this affect the health services? Would services need to be shut down or scaled back if we move to a stricter colour alert?
I know that the coded alert, as you describe, that NPHET have been working on, the Minister has been communicating on, and that's still in the process of dialogue as well. But ultimately, I think, as you've seen over the last few weeks in particular, the experience, I think what we are seeing in the country right now is we had predominantly been talking, and everybody's talking about when we might see a second surge. I think the reality is we're seeing what we see now is probably what we're going to be living with viruses, where we're going to see significant peaks and hopefully significant troughs very soon. And it may not be always national, it can be regional and in some cases local. So I think that's the new reality for us in terms of living with this virus and the transmission to date. So our kind of plans are now not so much around a second surge and a mass scaling up and scaling down. It's around agility, and it's around how we adapt and scale up and scale down, how we try get back our services, which I just referenced there a while ago. And we were very strong in our document that it is all dependent on the transmission of the virus at any particular given time. So we're constantly focused on, every week, where's the level of transmission of the virus, what services do we need to adapt. It's not always in the acute services. In fact, right now, the services we've had to step up are primarily in our community services, and particularly in our public health teams. So it's not quite as black and white as we might expect it at the start of this, where we'd see surges, and it's probably what we're seeing right now is going to be the reality.
Appreciate that, thank you. Just a question, if we have a localised cluster, say in a school or another location, and particularly in rural areas or areas that are distant from test centres, is there a mobile unit, is there mobile units that can be deployed, and how quickly can that be done to reduce the amount of travel time for people going to test centres?
Where the need arises, we do three responses. One, open some of our traditional swabbing centres. Two, we would deploy pop-up centres from the National Ambulance Services, and they've done a significant number of those across the country. And three, we would deploy our National Ambulance Services into a specific organisation or area that needs the National Ambulance Services deployed in terms of paramedics that would carry out the testing and swabbing for us. And so a combination of those three measures would be our rapid response.
Thank you. And in terms of the target turnaround time for testing, it's 2.2 days or 1 day less if in the hospital setting. Is there any part of that process that we could improve on to reduce that 2.2 days, either the collection time or the treatment time or the test results communicated? Are we working on anything to increase or to decrease that time?
Good question. So I'll try to be very brief, but I've always described what we put in place was a quick rapid fire kind of wartime model at the start, which we have modified very significantly over the last few weeks and months in terms of automation of the process. So to give you one example, the automation of the negative test results was one that we put in place, and that carries on. Secondly, an automation between our labs and our contact tracing teams, two systems interfacing. That took 24 hours off the process instead of handovers to different systems. And finally, Deputy, just to say, Ms Niamh O'Byrne is here today, is also working with us on what I've described in the opening statement as a future model. So we're now looking at a more standardised and permanently recruited workforce, both for our contact tracing and also for our swabbing. And finally, part of that will be looking at the logistics and the transportation of the swabs from various parts of the country to a lab that we can turn around much quicker. So we're looking at elements of automation, logistics, transportation and permanent workforce.
Thank you, Mr. Reid.